Let the client change clothes and then ask him to lie on his stomach on a bed. Apply massage oil to your hands. Rub the client's whole back with them till 风池 GB20 and 丰富 DU16 and press the 2 acupoints. Repeat 3 times. Divide the meridian into 3 sections and push them with your hands alternatively. Repeat 3 times. Divide the bladder meridian into 3 sections and push them with your hands alternatively. Start with the left meridian and the right one after. Repeat 3 times. Push from 大椎 DU14 to 2 meridian and bladder meridian with the base of your palms respectively, and lift from a waist side till your palms slide out from an armpit. Do it in left-eyed order. Repeat 3 times. Push from the back of the neck to adhesive mark connecting the neck and the shoulder with kneeling fingers. Repeat 5 to 8 times. Push from the back of the neck to the waist inch by inch with kneeling fingers. Repeat 3 times. Stroke and adhesive mark connecting the neck and the shoulder with the part between the thumb and the index finger, and caress it with the other hand. Repeat 5 to 8 times. Do the same with the other adhesive mark connecting the neck and the shoulder. Repeat 5 to 8 times. One side, push the whole medial border of the scapular with the part between the thumb and index finger. Do it alternately with your hands, and repeat 3 to 5 times. Push from the medial border of the scapular to the shoulder with your hands doing the by terms, and repeat 3 to 5 times. Move from your arm to a palm along the shoulder and slide out. The other side applies the same technique. Detox with a metal grease cup. It accelerates blood circulation, eliminates toxins, strengthens blood vessels, and relieves varicosity. Parameters setting. Advised operating time is 10 to 15 minutes. Suction can be adjusted per individual tolerance. Recommended mode is M1. Suction time is 0.4 to 1.5 seconds. Release time is 0 to 1.0 seconds. Suction should be longer than release time, or select M2. Push to meridian and bladder meridian with the cup. Repeat 3 to 5 times. Move the cup circle-wise along the meridian and the bladder meridian. Repeat 3 to 5 times. Slide the cup on the middle border of the scapular back and forth. Repeat 3 to 5 times. Slide the cup on anadesma connecting the neck and the shoulder back and forth. Repeat 3 to 5 times. The other side applies the same technique. Fix cupping with vacuum cups. Choose M1. Suction time is 0.4 to 1.5 seconds. Release time is 0. Suction can be adjusted per client's tolerance. Select the proper vacuum cups. Place them on 大椎 DU14. The Sakara region BL31 to BL34. Changing GB21 on both sides. And turn on SI11 on both sides, and leave them there for around 3 to 5 minutes. Remove the cups and clean the back with the towel. EMS pads. They make muscles exercise passively to relax them. Parameters setting. Suggested energy level is 2 to 5, which can be increased from low to high. The pulse radius is 50 to 300 muses. Suggested pulse time is 2 to 50 seconds. Recommended pulse time is 0.2 to 5.0 seconds. Recommended frequency is 50 to 300 each day. Advised operating time is 20 to 30 minutes. Fasten the pads onto a fatty part with a strap. Apply gel evenly to EMS pads. Press start. Remove the strap and pads after treatment. Clean the treated part. One to 2 times a week. A treatment takes 60 to 75 minutes. 12 times is one course of treatment. Contraindications: women in pregnancy or breastfeeding, with heart disease or a heart pacemaker, with unhealed surgical wounds or in surgical recovery, with epilepsy, severe diabetes, hypothyroidism, malignant tumors, etc. Those with skin disease or infectious disease should use it with caution.